very warm welcome to you, and thank you for joining us on Health and Wellness. My name is Zaitun Ali, and this and every Sunday at 6 p.m. right here on KTN Home, we bring to you features and tips about health and wellness. And today, we want to discuss about something very unique. It's hair transplant. Joining me in studio, I have Jared Babu, who is a trichologist and also a micro-pigmentologist, together with Peter Asugo, a clinical trichologist, and both of them are from Artistic Hair Transplant Center. Welcome to the show.
Thank you. Thank you for...
This is a topic that people don't really discuss about and have not even embraced as much in the society. But nowadays, I can see a change in it, yeah? And when we're talking about hair transplant, I want to throw this to you, Peter. There has to be hair loss. How does hair loss come about?
So hair loss, from the word, we see there's hair loss. For you to transplant is form of management of hair loss. So you have to talk about hair loss. Hair loss is interruption of the hair cycle. So hair cycle, hair goes through cycle. There's a time hair grows, falls, then it rests. So anything that interrupts this cycle will lead to hair loss. So there's so many causes of hair loss, from genetics to hormones to autoimmune conditions to stress to nutritional deficiencies. So all this can lead to hair loss. So if I may touch in terms of hormonal, we see androgenic kind of hormones. We talk of the thyroid hormones. If you go to the diet, we talk there's deficiency in nutritional aspect, like the iron, like vitamin D, vitamin C. We talk of stress. We talk of tologen effluvium. Stress also causes hair loss in terms of the cortisol levels. If the higher cortisol level, then will to destruction of the follicles. So anything that leads to destruction of the follicles will end up causing hair loss.
What about genetics? How does it come along? Because when your dad has a kipara, most probably the son will also have the other son. That's it. So how does it come about?
In the aspect of genetics, we have an hormone called androgens. And these androgens, male has testosterone. So the testosterone, there's byproduct of testosterone called dihydrotestosterone. So this dihydrotestosterone, if you're genetically predisposed, then it goes on to attack your graft, your follicles. So you end up losing hair. Subsequent attack of the follicles with the androgen hormones will end up losing hair, but it has to be genetically predisposed. That's why you see some people have hair loss through genetics, some people don't have. But then it also goes with age. As you see, men, as you age, some people lose their hair. Women also, female pattern hair loss. So it starts around 40, 39, around going up, because women also lose hair through genetics. Yes.
It also happens when one is expectant at some point, yeah?
Yes, but basically because of the change in the body, the breastfeeding, and when a woman is expectant with the breastfeeding, it can also be a combination of the two, like stress also comes with childbearing and all these kind of things. So we talk of tologen effluvium. You understand?
Okay.
Yes. So anything that disrupts the hair cycle then will lead to hair loss.
Okay.
So all those aspects of like breastfeeding and carrying out pregnancy, those things are stressful situations, and also changing hormonal aspect part of it.
That makes sense. So we've talked about the hair loss. So where does now hair transplant come in, and at what point do we introduce this?
Normally what happens when a client, let's say a patient comes in, now we take take him through, he or her, we take her through the basic checkups. We do some tests just to confirm whether he or she is supposed to do a transplant. We take her through how the procedure it works, and then after that we decide through these tests that we're going to perform, and then now we can say, okay, you are capable of now going for a procedure. Yeah, mostly that's what we do.
Yeah, because you must be a candidate for a transplant. Not
exactly.
You must be a candidate for a transplant. So through the diagnosis process, through consultation, then you have to make sure that this patient, their form of hair loss is the one that you take patient to do hair transplant. Like you see, stressful situation, those hair probably may come back. We have autoimmune conditions that you are not supposed to do transplant, like alopecia areata, where you see people lose hair in terms of patches. We have some autoimmune conditions like lupus may cause hair loss, and we also
chemo for cancer.
The
Yes,
chemo for cancer.
chemo.
Those are the medications can also cause hair loss. So this kind of hair loss may sometimes hair may grow back. So these are not basically, there are some conditions also, dermatological conditions like CCCCA, central centrifugal cicatricial alopecia. There are some conditions like fibrosis, frontal fibrosis. These are conditions that if a patients come in, we are very, very reluctant to do transplant. We have to take this patient through biopsy. So there has to be tests that has to be done, like hormonal. So you have to take your patient through hormonal profiling for you, because you're going to do transplant. Then you end up failing. Why? Because you did not analyze properly. You did not consult properly. You did not do the test properly. So there's so much has to be done before you put your patient for the transplant, because permanent transplant should be a permanent solution. Understand? And also you must have lost hair remaining with around 20% and below to achieve a successful transplant.
What is a hair transplant exactly? What does it consist of?
Hair transplant involves removing hair from one place and putting it to another place. But then you may think like you put it in a place where there was hair before. But some people may also want to put hair where there was no hair before. And that's why we talk of forehead reduction. People have big forehead, you want to reduce your forehead, you may reduce it with hair. So there was no hair. So you can put hair somewhere where there's no hair before. So you remove hair, but basically you remove hair from the back. Because this is genetically it's not preposed, so it's safer to remove hair from the back and then put it somewhere where you want to put hair.
Oh, so that's how it works. It has to come from your body.
It has to come from your body.
You alone, no one else. Like you can't remove hair from me and put it on him.
No, the thing is because
Yeah.
they are live cells. It's like we're talking of a transplant, kidney transplant, liver transplant. Hair cells are live cells. The follicle cells are live. So you have to go through that gene testing and all, but it is, as at right now, it is one person you donate for your own self.
Okay.
Then because there's so much involved, anti-rejection medication and all of that. And the follicles are very, very sensitive to survive in a different person. So at the moment, you are the donor and you are the recipient.
Oh,
Yes.
okay.
Yeah.
So like a kidney transplant, you get a kidney from someone else, and then now it is implanted on you. Hair.
Yeah.
Is it the same case? Can you get hair from me and transplant it to him?
No, at the moment you are your own recipient and you are your own donor. At the moment in terms of hair transplant. Because the follicles are live cells. So it has to go through those gene testings and autoimmune and blood works and all that. But at the moment, no, we can't remove hair from Jared and put it to be no. I have to be my own donor and my own recipient.
Okay.
Yes.
And Jared, when I'm asking, when your clients come in, most of them, what is normally the issue and why do they require this hair transplant? So there's several cases you've received. How are they?
Maybe as when they're coming in, and they require hair transplant, and the conditions that we have to look at. Number one, we normally check in. We normally sit down, start doing some tests. We ask clients some few questions about if they have undergone any medical histories, how are they doing their hair, how are they taking care of their hair before, were they doing a lot of chemicals, have they done a lot of braids. So those are the things, because now we have to determine if is it traction alopecia, is it CC, there's a lot of things that going a lot, so we need
define
the
what you've said.
traction alopecia, which means whereby a client he has been trying to pull up his hair by doing a lot of braids.
His braids and you mean mefanya?
Yes. So the more you do those braids,
the more I can't get a transplant.
Exactly.
Are you serious?
The more you pull them up.
The follicles become weak and they fall off.
Yeah.
So that is one of the causes of leading causes of hair loss in women as well. traction alopecia.
That's why we never have hairlines.
Yeah, that's
Yeah,
where the
actually.
hairline goes and the baby hairs goes, and it can be mixed even before. You have androgenic,
Yeah.
you have female pattern hair loss, and the same patient has traction alopecia, the same patient has androgenic alopecia, and the same person may have CCCA or FFA. So that's why Jared has said we have to go through tests for us to determine what's the cause of the hair loss before doing hair transplant, because we don't want our hair transplant to fail. So you have to do tests prior to putting our patient through hair transplant.
Have you ever found a patient who wants you to recover her hairline?
Yeah, we do transplant every day.
Okay.
And it's the most cases about hairline. Traction alopecia. It's
Okay.
about hairline.
Yeah, actually.
Kipara na kizungu inaitwa nini by the way?
Baldness.
Oh, baldness. Oh, yeah, bald men. So for them, actually, what's the process like when you bald and you want to get a hair transplant?
It's basically you're balding because of the male pattern.
Yeah.
You understand?
Yeah.
So most men lose hair. There are other forms of hair loss that men may also go through. They also go through traction. Let's say they have dreads and all these kind of things. But most men, you find them going through male pattern hair loss, which is the testosterone level, the caused by the hormone testosterone, which produces dihydrotestosterone, which goes to attack their graft. So there, you see men when they bald, here, there's a lot of hair at the back. So you don't bald at the back because there is not genetically predisposed.
Yeah.
So that's why we remove this hair from the back and then we put it where you've lost hair. So this, when you put it there, it is permanent because this hair is not genetically predisposed.
So this one will grow back?
It will grow back. That's the most interesting part because you have to check the right amount. And in Afro hair, as we've said, it's in classes of, hair has classes like types 1, 2, 3, and 4. So in Afro hair, we are in type 3 and 4.
So Afro hair is us, Africans?
Yes.
African, yeah.
Okay.
So we are in type 3 and 4. And type 3 also has A, B, and C. Type 4 also has A, B, and C. So when you talk of curly, you talk of kinky, you talk of wavy. So our hair behaves like that. And also that goes even to the follicle, the root down there. So when you are taking hair here, you have to be careful, like you're not going to overharvest. Overharvesting means taking too much hair. You're creating one problem to solve another one. So that's where we've gone further to understand how to harvest this hair.
So it needs actually expertise.
It is.
Yes.
How long have you guys been doing this?
I've done it for 8 years.
8 years.
Yes.
Okay.
Yeah.
The same?
Pretty much
Yes.
7
Yeah.
going to 8 years.
Yeah.
Oh,
Yeah.
okay.
So it requires
A lot of
experience.
experience.
Yeah. And doing it, and also learning a lot about it, traveling,
Traveling. Yeah.
consulting.
Oh, you have to
Other-
travel to get information, more
Yes.
information about
Yeah,
it.
Yes, we
because
do.
there's so many of our partners in South Africa, in Mauritius, in Belgium. So we have to create a society because African hair, in terms of percentage research, we are talking of around 40%. So when you talk of 40%, which means there's 60% which has to be done in terms of hair transplant. And that is why you find hair transplant in Africa, it's new. And it's new also in that we're also dealing with African people, which our hair is more complex and more it's magical, as we always say.
Yeah, it's magical.
So we have to go into depth when it comes to hair transplant in the African people, because it's different. Hair transplant started in Europe, in Turkey and all that. But you see, our hair is different. So it has to be narrowed down to African people when you're talking of African hair.
Okay.
Yeah, and it's very unique and it's very delicate. So we need a lot of expertise who have really understand, and they have been doing it for many years.
Yeah.
Okay, because as Peter said, most people, they look at it, it's a very simple hair, but it's not. It's a very complex kind of hair. So we have really taken a lot of time, understand it, and try our total best to make sure that by the end of the day, we get the results. As we have said, this is through by traveling, understanding with other partners, learning more ideas, and try to bring it back to our clinic and trying to making sure that we give our clients the best.
Okay.
Because we normally deal with Afro. We don't deal with other hair like Caucasian. Most of our patients, they are more of Afro hair. Yes.
Okay, and for you, I can see you've done a hair transplant. Is it?
What I've done something called SMP, scalp micro-repigmentation.
Scalp?
Micro-repigmentation.
Okay,
Yes.
what is that?
It's a form of camouflage whereby we find some patient we can't do hair transplant. Mostly in men who have bald more. Let's say you have bald almost 70%. So you have 30%. Out of 30%, there's no way we can extract 30%.
Oh.
Yeah, we can't, because normally there's some maths. We figures we're trying to, we normally draw, do some few calculation to know the numbers of grafts in that specifically area. But if we find out we can't achieve those kind of numbers, what we do, we give you another option. This option is whereby we create small dots into the scalp to imitate that there's hair.
Oh.
Because you see, the most important thing is to have a nice hairline. When you have a hairline, you look good. Without hairline, you look old. So once we give you this, because most men, they shave lower, we can give you that that kind of a look,
Yeah.
whereby you're not left out.
Okay.
So those are the other treatments that we do in our clinic.
Oh.
Yes.
So anyone who cannot do a transplant, the SMP, you've said,
SMP
is one option.
is one of the options, and it lasts a bit longer. So
Longer than a transplant?
no, it fades after some times, because
After how long?
It depends. 5 years. It depends with the individual. Again, at the same time, it's something that we're using organic pigments.
Okay.
Yeah, so we try our best not to use pigments whereby they can harm again your body. So it has to fade after some time. But you come in again for a retouch, maybe after 5 years or 4 years, depending, or 6 years.
Yako imekaa for how long?
I think this is like almost 4 years or something.
Oh, 4 years.
Yeah, but I always try to redo it, try to build it up. It's something that when you come in, it works as a session.
Okay.
So when you come in, you can't just do it once at a go. So you have to do it with sessions. So you can do one session, give yourself a time, like a week or 2 weeks, come back again, like that.
Someone will ask, how painful is it?
Hair transplant.
Yes.
In a scale
SMP.
of 1 to 10.
Yeah.
Because we use local anesthesia, both short-acting and long-acting. Because transplant, in Afro hair, we can't take more than 7 hours doing transplant. And this is best in that, because there's survival rate for the cells that are out. They can't stay long out.
Yeah.
And also we can't, when we are harvesting, we have to know the transaction rate, how the destroying of the grafts. So if you end up destroying more, you end up over harvesting. So in a scale of 1 to 10 in terms of pain, and we also use some vibrations and all that. So most of our patients say in a scale of 1 to 10, it's like 1.
And do you have to numb
feel
them?
pain when you're numbing.
So
After that, there's no pain.
when you're numbing, how are you numbing?
With so we use the insulin needles, the small beady insulin needles.
Yeah.
So you load the anesthesia inside those needles. Then you can do either a nerve block or you can do a ring block. So the patient which way, but we always prefer a ring block where you numb all this area and it stays numb for around 7 hours.
Okay.
And after that, then you give a patient painkillers, antibiotic, things like that to control after the procedure. So in a scale of 1 to 10, most of our patients says 1, sometimes says 2, but only when we are numbing. And after that, there's no pain after the procedure. When they go home, 3 days, they may be still numb even on the second day. But we give them painkiller with or without the pain, just to cater for the after effects. Yes. Yeah.
Do you see the results immediately after the transplant?
Not really.
Okay.
It takes time. Once you do a transplant, there's falling. We normally call it shock period, whereby it starts 1 to 2 weeks, and then we wait for around 4 months to around 6 months, and now I start seeing the hair growing. So we normally give a patient at least 12 months for you to see a full hair, because there's a cycle involved in it.
That long?
Yeah, there's a cycle of hair.
There's a cycle of hair.
Yeah.
Like, remember we had talked about anagen, the catagen, and the tolagen. So these hairs go through cycles as well. And transplanted hair, for you to start even seeing growth, if on the 3rd month, at least the 3rd month, we'll talk of around 30%. Then we move on the 4th month, we talk about 60, we talk about 50. As we move, as the month goes, because it tends to grow like a baby hair.
Serious?
Yes.
That's long.
Yeah, so full maturity is up to 1 year, but from the 6 months we are ready, prestige, like we're already sure what are we waiting for in the new for the 1 year period.
For the 1 period, yeah.
Yeah. So most of our patients, within 8 months, they're already happy. They discharge themselves. Like, doctor, I don't have to come see you anymore. I already have the results, you know. So yeah, basically.
So there's aftercare even after the procedure?
Yes, there is aftercare.
So is the procedure first and foremost before the aftercare? Is it invasive?
It's an invasive procedure because it has to be, it's involved, you have to take care of any other things like infection control. It's a procedure where there's a lot of blood involved also, but not so much because we use medication to control bleeding and all of that. So we even take our patients through tests to avoid complications during surgery. So we do blood works to determine that our patient, like you walk in today, you said, oh, do for me transplant. We'll not do for you transplant. We'll send you back. We tell you, oh, go this day, come, we do all these tests. Our test takes around 4 days. So when our test is ready, then you schedule in to come for a transplant.
Okay.
So you cannot just walk in and say, I want to do transplant today. No. We have to do the test.
Yeah.
And we have to consult, and we have to know the cause of the hair loss before we end up doing a transplant for you.
It's okay. I thought ni kitu ya mara moja tu unakuja you were like, hey, we need a transplant. That's it.
No, it doesn't work like that.
Yeah.
That makes sense. And we want to take a short commercial break. I know we'll come back with more about now the aftercare for the procedure. So how long should I come and see you again after getting the hair transplant? How do I take care of it? And you'll mention about that and a few others. We're taking a short commercial sorry, we're taking a short commercial break. We're coming back with more about hair transplant. I'll still have my guests over here, so don't touch that dial. Welcome back. If you're just joining us, remember this is Health and Wellness. My name is Zaitun Ali. And on our socials, you can find us at KTN Home _ or on Instagram and on X and on Facebook at KTN Home in case you have any questions. And also our WhatsApp line is 0759434389. I still have our experts here, Jared Babu, who is a trichologist and a micro-pigmentologist, together with Peter Asugo, who is a clinical trichologist, and both of them are from Artistic Hair Transplant Center. They're here to talk about what hair transplant is, what it consists of, and at what point is this procedure now coming into place when you have certain conditions and certain hair loss. So they've talked about it. And at this point, I want to also know that, let me ask you first and foremost, Jared, when you're talking about a micro-pigmentologist, what do you do exactly as a micro-pigmentologist?
As a micro-pigmentologist is a person who does pigment, because you see there's a pigment involved into it. So it's more of trying to create a camouflage in a certain area. Let's say you've lost pigment, you're trying to come up with a specific pigments just to camouflage it. So for SMP, because that's what we are more, because we deal with scalp, so now it comes in because we have to create small dots into the scalp to imitate that there's hair. So that's where the word comes in.
Okay.
Yeah.
That makes sense. Peter, there's the before, there's during, and there's after the procedure. One may ask, when I'm coming to do the hair transplant, I've passed all the tests before, and now I can do it. So how do I prepare for it, and what do I expect when I'm during the procedure?
So it starts by, again, when you come in the morning, we always tell our patients, at least have a good breakfast. And then that one, you already know the history of our patient very well. If they are diabetic, hypertensive, we check all these things prior. So the end of the procedure, you come in the morning at around 7 a.m. You wear clothes. Of course, we give you a change of clothes, but at least we don't want something, a cloth that passes top of your head. So at least you wear something which has buttons and all that. And you have to be in the clinic early in the morning. We have to design the hairline also, where we apply. We have to design it artistic way. So, you know, patients will say, I used to have hair here before, but then again, it's all consultative method. So we give each and every person has a different hairline design. Your hairline, his hairline, my all are different. So everybody has a different design. So we have to design it according to how their face structures is and how do they want the hairline to look. And as people who are designing this, we have to look at it before and after. Because the patient will just say, put it here, but then again I put it there. The hair will grow there, but how will you look after? So we have to advise our patients also very, very well that we put hair this way, but basically it's to put hair where you have lost hair.
So the machines that you use, they can show you how someone would look after the procedure?
It is art.
Oh.
And that is why we move further to talk about, in terms of designing, we talk about something like directionality, something like angulation, because if your hair were not facing this way, then you put them facing this way. And our hair are never straight. I talk of the follicles. They're not straight. They are acute angle. They are acute. So you have to put that hair onto the scalp also acute. So acute means 30 degrees below. So we place this hair from 5 degrees to 30 degrees. We can't pass 45 degrees of placing this hair to achieve the naturality aspect. Because it's not about just the transplant, let your patient go. You have to look at it, how will it be after? And the patient has to look natural. Yes.
Okay.
So the naturality aspect has to come in terms of transplant. And that is narrowed down to directionality, angulation. So it's also the art part of you has to come out in this kind of treatment. Yes.
So now that's during the procedure. You said 7 hours.
That is, yes. It takes 7 hours. We try to take 7 hours because we are limited. In Afro hair, we can't go past the 9-hour mark. And in Afro hair, we trying, because the cells tend to die very, very fast. And then again, somebody wants 4,000 grafts or 3,000 grafts. So we've come up with a figure, and we say in Afro hair, we are not going to do more than 2,600 grafts in one sitting. Why? Because cells tend to die very, very fast. And you harvest in a maximum of 3.5 hours. And then planting should also take another 3.5 hours. We are done in 7 hours.
Okay.
If we are prolonging these hours, then what happens? The hair starts to die. So that's why you see most people have gone through transplant. They are not achieved successful transplant because the hours that were taking that transplant, the cells end up dead. And the transaction rate also over harvesting. So these are the challenges and the new things in African hair.
There are those that are not successful?
Nope.
So,
yeah, you can't have a transplant, it's not successful. Either the technique, because Afro hair is very, very delicate. It's magical. So you may have a transplant and your hair has grown in patchy, which means they were overpacked.
Or maybe overharvest. Maybe when it comes to extraction, depending how they were extracted.
Yes.
Either they just didn't complete the extraction, so they just planted tissues on your scalp. So we have seen a lot of that.
Have you experienced that?
Yeah, we have seen a lot of...
but not in your hands?
No. Actually, we have never done that.
Because we've narrowed it down to see what works in Afro hair. And all the clinics that does Afro hair, they talk of the same language that we are talking here. Wherever you go in the world, be it South Africa, be it Europe, be it Mauritius, they talk the same language because we are partners and we work together towards approaching African hair.
Okay.
Yes, so the number of grafts, 4,000 grafts in an Afro hair, sometimes we say,
no, it doesn't.
pause, you're gonna, only 2,000 will grow, because you're gonna take how many hours harvesting 4,000 graft in an African hair? You're gonna take probably 6 hours, and we are only limited to 7-8 hours maximum. So what happened? If you take 4 hours, pretty much like 6 hours harvesting, then what time will you take to plant them? And we have a survival time of 7 to 8 hours. So you plant the 4,000, then only 2,000 will grow. So what was the need of going 4,000? Just take 2,000, plant them the required hours, then your patient will come back for the next session. Around 3 weeks.
Or a month. Or a month, yeah.
Yes.
Okay. So after coming, like after 3 weeks, is that it?
No.
Or what does it mean after that procedure, main procedure?
No, assuming a patient needs around, let's say, 4,800 hair grafts.
Okay.
That means you're talking in terms of a frontal hairline. Huh? So what we normally do, we say, okay, we advise our patient, because this is an Afro hair and there's a limit time. So we tell them, listen, we will do half of the side. That's what we do. So we give them 3 options on which areas they can plant the hair. And then we do half, and then they wait a bit for a month, and then we do the second session. We still go the same process. But at least by the end of the day, what we have done, we have given you a complete numbers of grafts that they are going to grow. Because you see, we have decided we are doing small section, but by the end of the day, we are going to give you maximum numbers of grafts. So that way that's why most of our patients, they end up getting very good results when it comes to hair transplants.
Okay.
Yeah.
And also, just to add also, because you see, people say you just pack the hair. But in Afro hair, it is not about packing the hair. It's about the art of doing that hair. It's about the number of grafts per square centimeter. Like I told you, our hair curls.
Yeah.
So let's say Caucasian hair, you are working with a square centimeter. They are straight. Caucasian hair is straight, Indian hair is straight. So you can pack it as much as you can. But in Afro hair, we are limited. Also, you pack it too much, there will be necrosis. There will be survival for the fetus in those areas. So, and then the hair curls. So one root will be touching another root. So you know what happened? So if a root, you planted your seeds, let's say in a piece of land, and you planted them close to each other, and then they curl. So what happened? One root will be touching another root. So only one will survive. So let's say you are supposed to put 30 grafts per square centimeter, and you put 60. So what happened? Only 30 will grow. So what's the essence of packing it 60 and you're only limited to putting 30?
Okay.
So that is the difference between Afro hair and other different kinds of hair, because of the curly aspect part of it. So
yeah, and when it comes to beards, do you do even hair transplant with the beards? There are some who do not have.
Yes, we do.
Yeah.
For those who don't have complete beards, again, there's a reason why you don't have beards.
By the way, what's the reason? Is it genetic?
No, it's just genetical.
Oh, it is?
Yeah, but again, when you want to have beards, it's a bit more complex, because we need to draw it, understand, because again, you'll find someone who does not have beards, he looks good, but he wants to have beard. So imagine putting a beard to someone and it changes completely, because beard changes the way you look. So we have to draw, understand this is how it's supposed to be, or we do only some specific area. Maybe you can do sides or mustache, something like that. But for beards, we do. A lot of clients that we get, the ones who have patches, you have beards, but you have some patches, so those ones we can fill them up.
Oh,
yes.
But not like a complete
for complete
makeover.
For complete, when it comes to Afro, we do not really recommend it as that.
Okay.
But we can draw, we see, and then we can advise you accordingly.
Because each and every person desire to look in a certain way. So it is art also.
Yeah.
During formation of this beard transplant and all that, it is art. Will you look off with the packed beard, or will you look natural? So we tend to guide our patients also on how they're, because you may have beard, you never had beard before, and you packed it and you look differently. So we have to take our patients through all these kinds of, because some people, you do transplant, beard transplant, and then after 6 months their friends tell them, oh, what's happened to you? Why do you? So it has to be, if art is not matching up very well with the the look after,
Yeah.
then you just advise somebody, let's do like this, let's monitor it, and then things like that.
Okay, that makes sense. So aftercare, after the procedure is done, how often should I come back to see the doctor to maintain it, and what kind of care is needed?
For aftercare,
Yeah.
it's normally what we, once you're done the procedure, as previously what we have said, you'll be given some medication. There's a special spray we're going to give you that you're going to use for around 6 days. Once you are done with that, you come in after 6 days for a wash. We wash it.
Okay.
Yeah, it's just it's a very simple, straightforward kind of. It's not that something you have to be bed rested or something like that. After that, there are some other treatments you have to do, because we'll have to do PRP, platelets-rich plasmas, whereby we extract blood, separate red cells and white cells, and then inject platelets. So it's the same thing as we are doing in the field, whereby you have plants, you need to do manure.
Okay.
So it's the same system.
So it needs platelets.
It needs platelets.
It helps in what exactly?
It helps normally in germinating the hair, just to build up the hair follicles. Because you see, when we're doing that process of extraction, planting, there's a lot of stress involved in between. So we need to make sure that when you're using platelets, they try to repair the cells up.
Okay.
Yes.
And basically putting fertilizer.
Are there,
So
are there any kind of advancements when now it comes to hair transplant so far?
There's I think there's a lot of because hair transplant has changed. All these things we're talking about in terms of even African hair, it has changed completely. Like even 4 years ago, what we are talking about was not out. And like we told you earlier, it's African hair, we are talking of 40% in terms of research. So we have 60 more. So if we have to get involved in the research, we have to get involved in the techniques that are coming in terms of hair transplant.
Okay.
Because we are guided by the statistics of how our partners all over the world are doing, and we are also doing. And we also even have other lab here we are working with to send them results to tell us the stages of these conditions. Because, like for example, in CCCA, central centrifugal cicatricial alopecia, these are conditions that you are reluctant, even not able to do transplant because of what's happening. So we have to work with the lab to help to see the stages of this disease. Because you can only do transplant when it has reached a burnout. But then you can't know when it's reached a burnout. You have to work closely with the lab. So you have to partner with all other stakeholders for you to be able to understand it further and guide people also in terms of research.
It's a team effort. And I've seen most of the people, prominent leaders, celebrities coming to you on your social media platforms. Most of these transplants that you do are cosmetic, not reconstructive.
No.
I think if you've lost hair, there's some inner depth of self, low esteem. You used to have hair, and now it's gone. You need hair back. So it is not, we say it is a bit more also trauma. It's psychological. It makes you have low self-esteem. So because you used to comb your hair, you can't comb your hair anymore. So this is like we look at our patient like they're in a hole somewhere. Our work is to lift them up. Is not to take them back down to that drainage. You understand? So they have lost hair. So we have to take care of them. And it is not, people think it's just cosmetic, because no, the people who have lost hair really, really understand how hair loss is. And we are together with them in this journey.
You understand them?
We understand.
So it's more of reconstructive.
Really? Oh, not cosmetic. It's not for the beauty part.
No, it's more of, because you see you have lost something, we need to correct it.
Okay.
So it's more of reconstructive.
Okay.
Yes.
Trust me.
Yes.
That makes sense.
And building up your self-esteem. And
but most of the time, actually, it's ladies who lose hair a lot.
No, funny enough, you'll realize patients who come in our clinic is 50-50.
Oh!
Yeah, it is. It is. Because you'll find there's a time we'll do men.
Yeah.
Sometime we just do women. So it's 50-50. Is that now there is a lot of which we are very happy to see that most people now are doing a lot of research.
Yes.
When it comes to now how to take care of their hairs. You know, before it was more my hairdresser. Now that one is people are getting out of it because they have realized not every hairdresser understands Afro hair. So even patients, when they come into a clinic, already they have proper questions. They know exactly, like they ask, how do I do this? What type of techniques are you using when it comes to a transplant? These are things that are there online. So people are doing a lot of research into that. So we can say that most people are very aware on that. So yeah, it is.
Most of them end up using which technique mostly?
No, most of us, we use FUE, follicular unit extraction, whereby we use a special machine with special punches, whereby we use to extract grafts.
It is called follicle?
Follicular unit extraction.
Okay, and the other one?
No, everybody is standard. Everybody does FUE. FUE.
Some are still doing FUT, but not.
What's FUT?
It was involving cutting a strip, like a strip. Then you put it out, then you slice the graft outside. So it was a bit. It's a bit aggressive, and the healing time, and all these kind of things. And then in Afro hair, you know, we don't leave our hair long as much. African people, we don't leave, so there will be a scar. So people have really moved to doing FUE.
Actually, when it used to come to FUT for Afro, it was a bit difficult because there's that cut you have in the back, and you need to shave your hair. So people will ask you what's the problem. But now with the FUE, whereby now we can extract single grafts.
Yeah.
So we just say, okay, you need 1,800 grafts. So we can extract 1,800 grafts in a just one graft. So that means you just have small, tiny holes whereby they heal, so they're less visible to someone.
And you've mentioned even something really a key point when it comes now to washing your hair, going to the salon. Do you go back and shave just the normal way, or after the transplant you do something unique about your hair when it comes to maintenance, both for ladies and gentlemen?
No, I think once transplanted,
you don't go to the salon.
No, you can.
What happens is we have to guide our patients now, because you come to us now, you are part of the family of how we take care of our hair. So we'll advise you, we've partnered with a few salons and a few barbers so that we tell them these are transplanted hair. We've shown them how to manage a transplanted hair. If you want to go for protective braiding, so we have shown them how to braid that hair which has been transplanted, because going for a transplant and then you braid again in a period of 2 months, 3 months, and what, you're gonna pull the hair. So we've taken them through protective braiding. We've taken through how to take care of that hair, what kind of products also to use for that particular
How long is the hair?
Sorry?
How long can the hair be when you're doing the transplant?
It takes to grow, or
like once it's healed,
it's permanent.
It grows.
How long? How long does it look like?
Oh, the length.
Yeah, the length.
It will grow back to where the length used to be.
Oh.
But then it depends because if we had fixed the baby hairs, hairs don't grow to a bigger length. You look natural, and the length will just come back the way it was before.
Does it really look natural?
Looks natural. If you've seen it doesn't look natural, then the technique
It was done badly.
It has to look natural, because when we talk of angulation, when we talk of directionality, that's where naturality comes in. If you check on our page, you'll see when we talk of natural, what naturality means. Before and after. It's just to mimic of nature. How God did it, just copy. So we've become very good copying.
What about the costing now, as you're winding up? How affordable?
You know, normally when it comes to cost, it varies with the numbers of grafts. Because you see, we charge by the numbers of grafts. Yeah, so it depends. So it depends.
An estimate?
In our clinic, we have tried to make it as much reasonable, because again, we look at it, a patient maybe wants to go and do it in Turkey. He has to cut tickets, hotels, so we've tried to reduct all that and made it maybe from around 160 to 250 there, depending, so we are more reasonable.
Okay, sio mbaya.
But do you know most of our patients, 25% of our patients are from the US, the UK. We get even patients from the Bermuda.
With Afro hair still?
Yes.
African hair. So if you do your research very well, then you'll end up in Artistic Hair Transplant Center.
Okay. Yeah. Where can we find you as we're winding up?
We are located at Riverside Drive, opposite Prime Bank, Chiromo. So it's called Dafton Court. Yes.
Okay.
Yeah.
Social media platforms?
We have a website, www.artisticclinic.com. And then we have Artistic Hair Center Instagram page. Yeah. Anytime you type artistic, you'll find us.
Sawa. Nasema SEO, search engine optimization in our letter. Okay, that's nice. Thank you so much for coming and for sharing your insights on hair transplant. I will refer people there. Wakuje kwa wingi.
We'll appreciate that.
Okay, guys, thank you for watching the Health and Wellness Show. You can find this episode on YouTube at KTN Entertainment, and also you can find us on our social media platforms at KTN Home _ on Instagram and on X, and on Facebook at KTN Home. Find me on Ali _ Zaitun on Instagram as well. Until next time, see you guys.
Accept that.
Get ready for an unforgettable experience. At KTN, we've got it all.